We're back with another episode of the Skinfluence podcast. I'm your host, Dr. Dustin Portela.
And I'm Austin Lee, physician assistant working with Dr. Dustin Portela.
And today we're going to be talking about an emerging topic that is getting a lot of traction nowadays, and that is the health of your gut and the gut-skin connection.
It's an interesting concept because a lot of people don't attribute what's going on in your gut to the skin, but we're finding more and more evidence that they are way more heavily connected than we had anticipated.
They're very connected. There's a lot of people that dismiss it as well. As more people are becoming aware and asking questions, sometimes they're getting brushed off by healthcare professionals saying like, oh, there's no link whatsoever.
Yeah.
And the research is continuing to show that's not the case.
Yep.
The biggest challenge in my mind is that we don't have a lot of precision medicine when it comes to the gut-skin connection. Meaning, if you have bad acne, I know that I can give you Accutane and get a very predictable result.
Yes.
But it's more nuanced when it comes to the gut, like giving probiotics or different things to drive the same outcome in every person every time. That's where there's a lot more nuance to this conversation, and we're going to dive into that today.
Yeah, I'm excited for it.
So, what is the gut-skin axis?
So the gut-skin axis is it's essentially the immune connection between the skin and the gut.
Yeah.
What we find is a lot of inflammatory conditions that originate with inflammation in the gut will begin to manifest on the skin. A lot of the same types of cells that regulate the immunity and immune response in the gut are the same types of cells that will respond in the skin. And so if one is being triggered, the other one will also be kind of offset. But
we don't have the same types of nervous system endings and connections in the gut. So it's not like you feel gut inflammation in most cases, unless it's very severe.
Yeah.
You've got ulcerative colitis or Crohn's disease or frequent bloating, gas, diarrhea, constipation. But you can have significant inflammation in the gut and you don't really know it.
Totally.
You just feel it maybe in your joints, or maybe you're
feel
dealing
tired
with a rash, you have brain fog, with leaky gut. There's all sorts of different things, but the symptoms don't always appear right in the gut. They can appear elsewhere, which is why it's confusing, and patients can be misdiagnosed or be told they don't have a problem. And this is where so many people are coming in and asking, I want to get to the root cause. And it's muddled, it's difficult. And there's no shortage of charlatans out there as well that will attribute everything to the gut. And that's also not the right approach.
Yeah. It's a kind of a cloak and daggers type approach where, it's all the gut. I can talk to you about that, but then there's no solid solution to the problems. They just tell you have these issues and then leave you stressed.
Or give a one-size-fits-all solution where everybody gets the same regimen of probiotics and everything, and that's not going to fix everybody's problem because they can have a different etiology.
Totally.
So there are some conditions that are linked to gut issues. That doesn't mean that if you have this condition that you have a gut issue, and some people may have a gut issue without having this particular skin problem. But one of those is acne.
Totally.
So acne, we know that there are certain foods that may exacerbate acne. What are the things you counsel your patients potentially to stay away from when it comes to acne and diet?
Yeah. So a lot of times when we see people who eat a high glycemic index, and we'll probably talk about this a lot for various conditions, but high carb diet, high sugar diet can inflame the gut, and then it can lead to worsening inflammatory acne. That's one of them. I do have a lot of patients who report that dairy causes their acne to flare. And those are probably the main things that we hear about that I can think of off the top of my head. I don't know if there's any others that...
Those are the main things. However, some people will be sensitive to gluten or have a frank gluten allergy.
Yeah.
That usually doesn't manifest as acne. If you're allergic to gluten, like a true allergy, there's a different skin condition called dermatitis herpetiformis that you can get. But as far as acne and the data that we have, high glycemic index foods and skim milk in particular, I think for some people, dairy more broadly might contribute to acne. And this can be due to high glycemic index foods, lots of sugar, raise your insulin levels. It's a growth factor. It can then have downstream effects upon your hormone levels and lead to more acne. So it's not going to happen to everybody, but in some individuals, if you're suffering from acne and you eat a lot of junk food, it might be something to cut back on.
Yeah, you brought up a good point. It's a lot of times it is the insulin levels that spike quickly that we find can do that. So focusing, if you love your carbs, complex carbs could be a good option because they don't have that severe spike of insulin. Yeah. So like your oats, quinoa, things like that you could replace with just your breads or other Cheetos. Yeah. Dang, not the Cheetos.
Not the Cheetos. I tried hot Cheetos for the first time, like last week.
Last week?
Yeah. I've never had them before.
No way.
Hated them.
Really?
Yeah. I thought they were awful.
Oh, I grew up on hot Cheetos. Ugh. They just came out with the dill hot Cheetos. Ooh. Not putting in a plug, but it was.
No, I don't think I could do that. I don't think I could do that.
Have you had Takis?
I do like Takis.
I do. I like Takis
like
too.
What is it? They have like an avocado flavor Taki or something.
Oh, I have not tried that one.
That was pretty good.
I gotta try that.
Yeah, not good for your acne, but
no, I don't recommend this. But
but we're real people, and we still like junk food from time to time.
Yeah.
So those are the things that we know can be linked to acne. Eczema is another condition that has kind of a nuanced connection with the gut. Not everybody that suffers from eczema will be suffering from a gut issue. There are genetic mutations in the skin like filaggrin defects. Filaggrin is a protein that's an important part of your skin barrier. And if you have a genetic defect in filaggrin or loricrin or some of your keratin producing enzymes, you're going to have bad eczema. Yeah. And it's not due to the gut. And sometimes you grow out of those. But if you have gut inflammation, sometimes that will manifest as eczema and you don't have one of these mutations in your skin.
Yeah. One of the things that we see with eczema is something called atopy, which is a syndrome of different conditions, allergic rhinitis or seasonal allergies, asthma, and eczema. But we also find that people who have atopy tend towards food allergies as well. And I have a lot of concerned moms and dads who have kids with eczema who are just diving down the rabbit hole of what can I feed or what can't I feed my kid? And it can be a daunting thing, especially for young parents with newborns. And so I try to reassure them, listen, very often kids with eczema can have food allergies, but it's not necessarily that one is really going to exacerbate the other. Yeah. So let's focus on getting your child to sleep. Let's focus on the skin, and then we can go from there. But
right, exactly. And what came first, the chicken or the egg? If the kids got a little eczema and now they're sleeping poorly, that can impact the gut because your cortisol, your hormone levels are going to go up. You can be more prone to leaky gut. And then if you can just get the kid to sleep better and stop scratching, simply by using a topical steroid, the gut can actually heal itself. And that's one of the lessons, is that if we can support the body's optimal health, both the skin can improve and the gut can improve. And sometimes it's not just taking a supplement or taking a medication, but it's just more supporting the holistic health. Yeah. And the body is usually pretty good at healing itself.
It is.
And there's, I've seen people with poor diet that have exacerbations of seborrheic dermatitis or dandruff. Yeah. Based on, eating lots and lots of oily foods or even using some of that on their skin. So psoriasis, I know I've seen patients improve their psoriasis by cutting out dairy. And I think this just gets to, when we talk about why is this? Why are some of the mechanisms? Well, if we drill down into it, we have so many bacteria that live in our gut. We have, if you can think of your whole body like its own ecosystem, and rather than treating an organ system, like we're dermatologists, right? So we treat the skin, but it's important to know the skin doesn't occur in isolation. Yes. And a gastroenterologist that treats the gut, knowing that the gut doesn't occur in isolation. So trying to think of your body as its own ecosystem. And when something's going wrong with the body is just doing that in a way to try to restore its own homeostasis. Yes. There's a problem in the gut, so inflammation is going up to try to fight a problem that manifests on the skin, but the body's really just trying to fix itself. Yeah. When we start to develop these symptoms. Yeah. And if you keep throwing Snickers bars in your diet every day and you've got gut inflammation, you're going to still wake up with sore knees in the morning, for example.
Totally.
That's the story of my friend just asking for a friend about that.
Yeah.
Definitely not me.
Yeah. I totally agree. We do tend to look at things in isolation, and in medicine, we go into our specialties and we tend to just think in that specialty. Yeah. And that is the culture of medicine these days. And I've heard many a patient talk about how they're frustrated where they're going to all these doctors in different specialties, and they're all kind of describing similar things, but they can only work on one part.
Yeah.
And so another thing that you're talking about though is the body will heal itself. And if we're giving our body poor nutrition, we're not fueling it the way it needs to be fueled. If we're not resting, which is really where our body is able to sleep, or our body is able to recover, is when we're sleeping, and hydrating ourselves well, we need to give our body the things it needs to work well, and we tend to not do that, unfortunately. But you're right, it's all connected through these, and can help through homeopathic methods.
Yeah.
And as clinicians, as doctors and PAs and nurse practitioners, we're here to try to help guide you to help your body help to fix itself.
Yeah, it's not always about adding in something. Sometimes it's taking something away. Mm-hmm. And this is why I believe, we will see people that say, I went carnivore and it fixed all of my problems.
Yeah.
And they're only eating carnivore. So is it really that they needed that much protein in their diet? Or some people say, I went vegan, I went vegetarian, and it fixed all my problems. Well, is it really that you went vegetarian or vegan? Or is it that when you made that choice to be so restrictive in your diet, now you're not eating all the crap that you were?
Yeah.
Because you can't be carnivore and then eat cookies.
Yeah, totally.
And most of the time when you choose to be vegan, you're not eating a bunch of like extra breads and carbs and all these things. So sometimes it's just you're cutting something out, not necessarily that you went strictly to a specific diet. In some cases it may be.
Yeah.
But that's just my thought on it, is it really because you went carnivore or because you stopped eating cheesecake?
Yeah. And it's probably you're not eating the bad thing anymore.
Yeah.
Which is great.
So
how do you think stress plays a role on our skin gut?
Yeah, when you are stressed, you are experiencing elevated levels of cortisol. It's your body's stress hormone. And cortisol will disrupt your gut barrier. So just like you have a skin barrier that doesn't let bacteria in and it keeps water in, we have a barrier in the gut that is highly specialized, that is designed to work in harmony with bacteria. Mm-hmm. Bacteria help break down our foods. Yeah. And they release byproducts, things like butyrate, that actually work as a fuel for the lining of your colon. Mm-hmm. So butyrate is an important fuel for your colonocytes. So all of these things interplay and break foods down to the point where through special channels, they're absorbed into the body.
Right.
And when that is functioning properly, we don't have inflammation. But if it gets disrupted, then we start to have increased inflammation. So just like your skin barrier can be disrupted, your gut barrier can be disrupted, and you can get things like leaky gut.
Yeah.
But when you have excess levels of cortisol, the barrier function of the gut is compromised. And so things that shouldn't be getting through, that maybe haven't been broken down sufficiently, are getting in deeper in the crypts of your colon or in your small intestine, and then your immune system has to manage that. And so you're forming immune complexes, and your macrophages aren't breaking those down properly, and you're getting an inflammatory cascade, which then drives more stress, more cortisol. So you have to do things like get good sleep. Of course, nutrition is what we're talking about here primarily, but stress management techniques will help with eczema. We know that.
Yep.
Can also help with a lot of different gut problems. So stress is very detrimental to the barrier function of your gut and your skin.
Yeah. A common cycle that I see with my patients is they'll become stressed for whatever reason. Something that they have in the background, like psoriasis, manifests itself, and or eczema, or their perioral dermatitis, or something that inflammatory hives. that condition, because it is distressing, people see it, causes them to feel more stressed, and then it just is this
self-defeating cycle.
It's and so that's where we can step in as clinicians to try to help break the cycle, help calm down the skin or whatever they're saying, and calm that down. Another thing that we see with that is telogen effluvium. When people get stressed, their hair tends to fall out, and then they get stressed that their hair falls out, and our job's to reassure.
Yeah. Just becomes a bad cycle.
Yeah.
So there's a lot of different things that we can recommend that can help to improve the health of your gut. But before we jump into all of those, let's do a little Did You Know?
Okay, let's do it. Well, did you know that there are more bacteria living in your gut than skin cells you have?
Holy cow, seriously?
Yeah.
Like I know we have like billions and billions of skin cells.
There are trillions of bacteria living in our gut.
That's crazy.
Yeah. It just goes to show what you were just talking about, where we need that gut bacteria. And if we're disrupting the barrier, they can't thrive or live there.
I mean, it really is its own ecosystem. You think about all the people that are living on the planet in most of the time in harmony with each other, but it's an ecosystem. And there's, battles that happen and things, but that happens in the gut too with all these different bacteria, good and bad. And my Did You Know is that there's actually certain strains of probiotics that have been shown to reduce inflammation and improve acne.
Interesting.
Yep.
Yeah.
So there's definitely certain things you can do in adding into your gut if you're truly deficient in those things that can then have an impact.
Interesting.
And so that kind of takes us into the next section of the podcast where we're going to be talking about things you can do to support your gut.
I'm sure there are tests where you could swab the gut and see, okay, you're growing this bacteria, you're deficient in this. It'd be interesting. Our stool samples can probably do a lot of that. Not a readily common test that we see or I hear about, but I'm sure people are doing them. And then you can tailor that probiotic.
Right.
To.
And this is where I think it's important. It's not the easiest thing in the world to do a stool sample.
No.
It's not fun because you got to collect that at home. You got to put it in a little jar and send it off to a lab, or you're, having to
carry it to
the lab, or take a number 2 at the lab so that they can process it. I've never had to give a stool sample, thankfully. But I probably will do that test on myself because I just completed a gut immune system CME certification.
Oh, yeah.
And so it's something that I want to learn more about. So I've been studying more about it. And I've learned that a 3-day stool test gives you better information than a single stool test.
Yeah, a little snapshot.
Because there's so much fluctuation in your gut bacteria based on what you eat in a 24-hour period that your gut microbiome can look wildly different 2 days from now than it does today.
Yeah.
And so if you can do a 3-day sample, that is generally better. And what we can learn from that is, what is the complement of your gut bacteria? We have certain bacteria that are very beneficial, things like Clostridium, Bifidobacterium, Lactobacillus, Akkermansia. These are important species that some of their metabolic byproducts feed each other.
Yeah.
Some of their metabolic byproducts feed the cells of the gut.
Right.
And we need those. And if you get an imbalance in the gut microbiome and you get an overgrowth of pathogenic bacteria that aren't supposed to be there in high numbers, you can then lead to some of the problems that we've talked about with your gut and your skin. And so only by testing the stool do we know what your microbiome looks like. And then can we make real solid recommendations to improve that?
Yeah.
And that's not something we can do over a podcast, obviously.
Yeah, no.
So the recommendations that we're going to talk about are, in general, things you can do, but you should not do all of these things at once.
Yeah.
Because you're probably going to have some GI distress if you do all of these things at once, because you'll wildly change in a short amount of time your gut microbiome, and you'll be listening to the podcast from the toilet.
Yeah. Which, if you're listening, that's great.
We appreciate you listening,
appreciate the
even
listen.
if it's on the toilet. But we don't want you to have to be rushing to the toilet because you did all of these things all at once.
That's good advice. It would be really interesting to see, what does my gut biome look like when I'm just eating junk food for 3 days?
Yeah.
And what does it look like when I'm eating really clean for 3 days? That would be an interesting topic. But, well, the first thing that we always, that we will always recommend for people when they're struggling with gut issues, or if they want to improve their microbiome, is fiber.
Fiber.
How does fiber help our gut biome?
Fiber comes in two types. There's soluble and insoluble fiber. And generally, fiber is something that we are not absorbing into our body. Mm-hmm. Fiber is in the gut, and it is things that, because we don't absorb it, they are sugar-type molecules that we don't have the capability of absorbing, husks of different types of vegetables and fruits. Yeah. But bacteria can eat them. They can be fuel for bacteria that promote more healthy bacteria to be growing. They also help the stool to move through your gut better. They draw water into the stool so that you're not constipated. And this is probably one of the biggest areas that processed foods have hurt in our modern diet, is stripping away all of the fiber. Because fiber is hard to chew. It's hard to swallow. You think about eating whole fruits and vegetables. They're crunchy. You got to chew them a bunch just to swallow them.
Celery.
So highly processed foods strip out all the fiber because they go down so easy. They're so palatable. They add in sugar and butter and all of these things, but there's no fiber to them to actually help keep moving through the gut and to feed the good gut bacteria. Yeah. So you need to supplement fiber by eating whole vegetables and fruits with the, the peel on the apple, things like that. So fiber plays a critical role in gut motility and in feeding your good bacteria.
Yeah, it helps to line the gut with the food that your bacteria need.
Yeah. What is it about high glycemic index foods that in the gut, microbiome? Why do we recommend avoiding those?
Well, for what things that we've discussed previously, number one, it's instant sugars, basically. So you draw that into the blood, and it's going to spike your insulin. It'll spike, and then the cortisol has to go up. And as we talked about, that can lead to a lot of inflammatory markers coming into the blood, and then causing inflammatory conditions to worsen. Yeah. So that's really what we see on the skin, why we don't recommend high glycemic foods. But a lot of times, high glycemic foods, like you have discussed, a lot of them are very processed. They stripped away a lot of the nutrients. They give you the things that taste good and things that go down easier, and they're not actually nutritious for our bodies. And so that would be my main thing that I recommend is for people with inflammatory conditions, don't eat a high glycemic index because of that. The insulin response, the cortisol response, and then leading to the inflammatory response.
And some of those simple sugars will feed pathogenic bacteria. Yeah. They're going to thrive on that. Yes. Whereas the good bacteria often need some of these more complex fibers and things. So if you're just dumping a bunch of sugar in, you're not giving the good bacteria the kind of fuel that they need, and you can get an overgrowth or an imbalance of bad bacteria. Yeah. So that's another good reason to avoid that. Now, so fiber is kind of your like prebiotics, things that will help to support healthy bacteria, but there's also probiotics. Right. Probiotics are going to be actual bacteria, sometimes dead bacteria, sometimes live bacteria, preferably live bacteria, so you can actually try to repopulate your gut with healthy bacteria.
Yeah. Have you ever tried the liquid probiotics?
I haven't tried liquid probiotics, but I have had kefir and kombucha. Yeah, those are things like that that have good bacteria. And high quality probiotics are going to be things that have like Clostridium strains in there, Bifidobacterium, Lactobacillus, and Akkermansia. And there's so many of these over the counter, and they're not all created equally. Sometimes those capsules, they say they have so many colony forming units. That should be live bacteria if they have colony forming units in them. Right. But understand that things like Akkermansia, which is really good to help control blood sugar, they need to be refrigerated. Yes. because they're so sensitive to temperature and to oxygen. It's a gram-negative type of bacteria. So they have to stay in the refrigerator. And I need to do more research into this company because a patient brought in their Akkermansia probiotic that they bought on the counter at the grocery store, and it was not refrigerated, and they weren't told to keep it refrigerated. Whereas in the clinic, we carry Pendulum probiotics, which have Akkermansia, but it has to stay refrigerated. It's shipped with ice packs, and we put it in the fridge immediately because that's the only way that Akkermansia is going to stay alive.
Yep.
Now, my approach to probiotics, because you have to do this carefully, probiotics, just like any pharmaceutical, is not a panacea for all problems in the gut.
Yeah.
You can't just start taking probiotics, and you don't necessarily have to be on them forever, because the goal is that if you're deficient in a specific type of bacteria, if we can supplement that and then get it to engraft, meaning it actually populates the gut and sustains itself, then you don't need to keep taking it. Because if you're always taking it, you're going to then crowd out other types of bacteria that you're not taking.
Right.
So I just take the same approach here. It's like, if you don't want to be on a medicine forever, you also don't necessarily want to be on a supplement forever, because you're spending money and it can lead to its own imbalance.
Yeah. If you're being recommended a supplement that you have to take for the rest of your life, there's your sign.
Yeah.
That you want to be able to sustain a healthy lifestyle without it.
Right. And in some cases, if you have a genetic deficiency, you have to take it for your life, but you should know that that's why you have to take it.
Yes.
So some people have a methylation problem and they need to supplement methylfolate, for example. Whereas if you don't have that, you can get folate through your diet. There's fortified food. So it's one of those things where I just am a big believer in test, understand the problem, correct the problem, retest, and if you're good, you don't need to take it forever.
Yeah.
So
I agree with that. Test, fix the problem, make lifestyle changes so that way you don't have to go back to that problem.
Yeah, it's going to come with lifestyle changes. Anything good is worth working for.
Yep.
And pills don't fix lifestyle. Supplements don't fix lifestyle. If you don't start working out, if you don't sleep better, if you don't eat good, nutritious, whole foods, you're not really fixing a problem.
Yeah.
And you're just reliant on a pill.
Yep.
The supplement industry is bigger than the pharmaceutical industry. When you look at the total dollars spent on wellness industry,
I did not know this,
is bigger than the pharmaceutical industry.
Wow.
And they're unregulated.
Yeah.
And I like supplements. I take certain supplements, but I take them when I need them.
Well, I've heard the saying that Americans have the most expensive pee in the entire world.
I believe it. I believe it.
So, we discussed lifestyle changes, we discussed probiotics, we discussed even sleep habits. What about people who struggle with stress and anxiety?
Yeah. This is an important thing to consider. And sometimes these conversations that we have around health, for some people, trigger more stress.
Yes.
Because then all of a sudden people feel like, oh, I'm not doing enough. I'm not doing this. Or maybe I have this problem and I don't even know it. And they get health anxiety. And that's a real problem. And that's not the goal that we have on this podcast, is to initiate more health anxiety in you. We want to really empower you to make informed decisions. If you have significant stress, one of the best things that I think you can do is put down the phone.
Yeah.
Walk in nature for 15 minutes. And nature might be your city park. There might be cars and hustle and bustle that you still hear. But you can't, documented studies where walking without headphones, without looking at your phone, listening to the sounds of the world for 15 minutes will significantly lower stress hormone.
Yeah, I believe that.
I love standing in the grass in the morning, grounding. I think it's a little hokey, but I feel better when I do it.
Yep.
And I see a little sunshine coming up over the horizon. And I've got sunscreen on my face usually. Yeah. But I like the way that it makes me feel. I like to meditate. I like to sit in a sauna. I like to play with my kids. But one of the biggest things for me that reduces stress is distance between me and my phone.
I would 100% agree with that. And it's hard. I go home sometimes. I'm like, I'm going to put my phone in my room and I'm going to go be with my family. And 5 minutes go by and I realize my phone's in my pocket and I'm pulling it out and it just happens. Yeah. I would also add, I agree with all of that. My wife has introduced me to grounding. Okay. Like I'm not a big barefoot guy, but I have enjoyed it. Feeling grass does do something.
I think it does.
And it's been good. Getting sunshine, being out walking, being in nature, meditating is something that I do practice. And also I've incorporated this recently, and I found that it is very calming for me to just write down, journal.
Yeah.
Writing down thoughts, writing down my anxieties, writing down things that I worry about, writing down things that I'm grateful for, practicing gratitude through that. And that all has been really helpful in managing some stress that I've been feeling. And it's been a good thing. So all those things I think are all very, very good to help calm down stress. A bedtime routine.
Yeah.
Getting into a sleep routine where you do something at nighttime that's calming. Reading a book even is a calming thing, and then getting into good sleep habits also help reduce stress.
I heard some good advice recently where you plan your day, and your day starts when you go to bed. And that's the non-negotiable time of the day. That you have to start your day by going to bed at 9:30 or 10 o'clock or whenever it is.
That's really good.
Because if you make sleep the last thing of your day, it's going to get pushed off by all the other things. You're like, this is it. This is the start of my day is when I go to bed. And then everything else has to bow to that. And that'll make a difference. But all of the things that we've talked about are healthy coping mechanisms for stress. Just be aware. Don't feel like a failure if you pursue unhealthy coping mechanisms, but that can be binge eating, eating inappropriate foods, drinking alcohol, doom scrolling on your phone. They temporarily relieve stress, but they're not relieving it. They're just pushing it off to the side for a minute.
Yes.
And it's all going to come rushing back after that activity. Whereas most of the things we've talked about and recommended will actually lower the stress.
Yes.
So
those are all distractions from reality, and eventually you have to come back, and then things come rushing in. But when you are able to face reality, or face the reality of nature, face the reality of the listening to the birds chirping, that all is a very calming thing.
Yeah. And then if you're still struggling with stress and anxiety, go get professional help.
Yes.
It's critically important to take care of yourself. And the world today tempts us to put ourselves last in many cases to meet everybody else's expectations.
Right.
And you really need to make sure that you're taking care of yourself. And when you take care of yourself, you can be your best self for everybody else much better.
Yes. And as medical professionals, we're here to help take care of you. We're not here to push big pharma. We're not here to push all these different medications on you many times, but we are here to help you heal in the ways that we can in our specific specialties. We do try to look at things, at least in our practice, I feel like we try to look at things from a more holistic view and not just from the skin. And I'm having more and more and more conversations about exactly what we've been talking about today with my patients. But it's not, you should never feel ashamed if you're seeking professional help for any of these things that we've been discussing, because we're here to help you heal and feel your best.
Yeah. And when it comes to your gut, that's also an area where you can try to implement a lot of the things that we've talked about. These are broad general recommendations where if it's not helping you, you need to have tests done. You need to have the stool test. Maybe you need other metabolic testing to see if you have a problem absorbing certain nutrients that you need to supplement. And so that's another indication to go get professional help. If making these types of lifestyle changes to your diet, to your stress, to your sleep, and you're still struggling with a gut issue with frequent bloating, cramping, diarrhea, certainly any blood in the stool, go get professional help right away.
Yeah, so, I would agree with that.
And also, I'm just going to make a plug. Get your colonoscopy. If you're 45, the age in the United States has been lowered for 45 to get your first screening colonoscopy. I think it's a travesty when people die of colon cancer or skin cancer when it could have been caught much earlier by regular routine screening.
Yeah.
So
I had a patient recently. Her colonoscopy got put off because of COVID. Delayed by 4 years, and they found a polyp, and it was cancerous. And now she's having to she's behind the 8 ball. Yeah, they think it's going to be treatable, but it's a scary thing. So it's always good to get that checked.
Yep. Most every doctor that I know personally, myself, everybody that I practice with, has this approach. We're here to help. We want to give you the best accurate information possible. Yes. We want to support you in your health journey with accurate information and empower you, not to scare you into doing something. So thank you for joining us on this journey with the Skinfluence podcast. For those of us that are seeing us in the clinic, thank you for being our patient personally.
Yeah.
We're grateful for your support in this, and we want to encourage you to leave us a 5-star review wherever you listen to podcasts. Take a screenshot and tag us on Instagram at SkinfluencePod, at Austin Lee PAC, or at Dr. Dustin Portela, and send us your questions. Thanks for joining us, and we'll catch you guys on the next episode.